As Governor Abbott forced himself into a COVID corner, Austin and Dallas school districts are now defying his no-mask mandate as the Delta variant surges across the state. Here to talk about this is Travis County GOP Chairman Matt Mackowiak and senior strategist Glenn Smith from Progress, Texas. Glenn, should the governor give back control to county judges and school leaders, or is a no-mask mandate still the best thing for Texas?
You know, I think he should give back control. I think it was a terrible error to try to manage locally, from the state level. You know, his own Department of State Health Services said recently, when they were turning down additional money to hire out-of-state nurses, that emergency management begins at the local level. Governor Abbott should follow that advice, especially when it comes to school children who, under the age of 12, I don't believe can even be vaccinated. It's not a matter of personal responsibility. Masks protect other people, not the mask wearer. Let's protect the children of Texas. Governor Abbott should let local school districts do just that.
Okay. Matt Mackowiak, are school districts doing the right thing going against the governor?
Well, that's an individual decision that each independent school district and their superintendent has to make. Obviously, the courts are going to have to now get involved and determine whether this is something that is lawful or not. You know, the cities are not entirely created by themselves. States create cities. And so we have to keep that in mind. The state has primary responsibility and authority, and that's how the courts, I think, will ultimately rule. Now, that said, parents can choose to have their children wear masks. No one says that they can't. But Glenn's right, under 12 you can't get vaccinated, but we're also not seeing massive numbers of people under the age of 12 in hospitals dealing with the Delta variant. Look, let's be honest about the Delta variant.
You know,
it's not affecting deaths.
I'm sorry, go ahead.
I was going to say that the Delta variant is not really affecting deaths, except for people who are unvaccinated who also have comorbidities. That's a subset of a subset. What it is doing is it's leading to more cases, and that's putting pressure on hospitals. And so schools are not the problem. Of course, schools are about to reopen. But we are seeing unvaccinated people with comorbidities, and that's where the problem is. Okay.
You know, is there a middle ground between freedom and science? And the messaging can certainly be confusing for Texas. For example, this is what Senator Ted Cruz had to say on television.
And I've introduced legislation, a bill to ban vaccine passports. This week I'm introducing a bill to ban vaccine mandates. And this week I'm introducing a bill to end mask mandates.
You know, Glenn, Ted Cruz is criticized as being pro-death. Is that too harsh?
I don't think it's too harsh, but I'd rather not get too political about this. I'd rather remind people that vaccinations protect the vaccinated and those the vaccinated comes in contact with. Masks protect other people, your family members, your children, your neighbors, people you might come across on the street or in a restaurant. Masks protect others. Think of them like red lights. Would Senator Cruz or somebody else pass a bill saying nobody has to stop at a red light anymore? Why can't we put life first and health first and stop the politics?
You know, Matt, who should have the authority to decide if masks are mandated? Is it parents, politicians, doctors?
Well, ultimately, the problem is that there's going to be a lot of different opinions. And ultimately, the Texas voters elect one person to govern the state of Texas. And that person, I think, does have authority in this case. And again, the courts will rule on that. And if Dallas School District has their own authority, then the courts will rule that way. And that's how it will work out. And it'll work out before school starts. This is a balance. It's a balance between mandates and freedom. It's a balance between public health and the economy. It's also a balance of information that's changing rapidly. The Delta variant, I do believe, is plateauing. We are seeing limited ICU bed space. That's a very real concern. But this is a question of cases, not as much a question of deaths. And individual risk tolerance has to be up to the parent and also has to be up to the individual. And if we shut down again, it's going to harm our economy and harm far more people than need to be harmed.
Okay, well, we are still in the middle of it, and we are out of time, so we have to wrap it up. Glenn, Matt, gentlemen, thank you both very much.
Thanks.
You're welcome.